guys, it's Crystal from livingwithgastroparesis.com. It's time for FAQ Friday. Today I want to answer a question that's been going around my Facebook page. I've gotten a few by email in regards to something I posted earlier this week on my Facebook page, an article about Canada deciding to put stronger warnings on Reglan. Now, you might remember a couple of years ago, the FDA actually gave Reglan a black box warning, specifically in regard to the risk of tardive dyskinesia. Now, that's a neurological side effect. It can be really serious. It can be really severe. It's basically uncontrollable movements, muscle movements. It can be your tongue, your lips, your extremities, and it can be permanent. So for a lot of people, they stop taking Reglan, but they can still have these uncontrolled muscle movements, and it can be really bad, really severe. And so that's what eventually prompted the FDA to put this black box warning on Reglan a couple of years ago. Now, Canada has just recently said that they are also going to issue stronger warnings on the packaging. So that leads to the question that's been going around my Facebook page, the question I want to address today, which is, what are the alternatives, and are they safer? And that's a really good question, obviously. There's really only one other prokinetic medication that's approved by the FDA. Now, a prokinetic medication is basically one that encourages movement. So it's a medication that causes the stomach muscles to contract and therefore helps the stomach empty the food. The only other prokinetic that's approved by the FDA right now is erythromycin. And erythromycin is an antibiotic. It's used in very low doses for gastroparesis. There are really two issues with the erythromycin. The first is that it can cause GI side effects, so nausea, abdominal pain. Basically, the things we're trying to get rid of are pretty common side effects, and so that just makes the medication intolerable for some people. The second thing is that the efficacy of the drug kind of wears off with repeated constant use. So you almost build up a tolerance to it over time. So a lot of doctors will have you cycle on and off the medication or just save it for flare-ups. So it's not really effective when taken consistently over the long term. The other option, the other prokinetic medication that you probably have heard about that a lot of gastroparesis patients are taking is called Domperidone. And the brand name is Motilium, so you may have heard either one, but it's not FDA approved. It's available in lots of other countries. You can get it in Canada, New Zealand, and it's been used in these other countries for a long time, but as far as I know, the manufacturer is not pursuing FDA approval. For whatever reason, they're not interested in that. So you can get it, though, with a script from your doctor, from a pharmacy in one of these other countries. Like I said, Canada and New Zealand are two of the pretty popular ones. Not every doctor will write a script for it, but a lot of doctors will. So, if you have had a reaction to Reglan, or you just don't feel comfortable taking Reglan, this is certainly another choice. And it works similarly in that it's prokinetic, it helps the stomach contract, it helps the stomach empty, but it doesn't cross what's called the blood-brain barrier. And so that's what gives Reglan the potential for these severe neurologic side effects, is that it goes into the brain. Domperidone doesn't do that, so it doesn't hold the same potential for neurological side effects. It does, of course, have its own side effects. It can increase levels of prolactin in the blood, and that can lead to lactation in women, breast swelling in both men and women, and there are some other side effects, potential side effects too, just like any other drug. So you want to educate yourself, you want to weigh the pros and the cons, you want to talk to your doctor about all of your options. But those are really the three prokinetic medications available: Reglan, erythromycin, and Domperidone. The second half of this FAQ is, maybe you've tried Reglan, Domperidone, erythromycin, maybe you tried all three, maybe you're on one of them right now. and you're really not noticing much of a difference in your symptoms. You still kind of feel lousy. What gives? Unfortunately, that's true for a lot of people, and I think it has to do with something that we've been talking about a lot on the Facebook page lately. I've been talking about a lot on my blog, and that's that there's likely something else going on in many of these gastroparesis cases beyond just the dysmotility. And this is something that I've started talking about with my own motility specialist, and it seems to be that there's the slow emptying, but then there's another piece of this that we really don't understand very well yet, and whether it's the message from the gut to the brain and the brain to the gut, whether there's some kind of a mix up there, whether it's like an extra sensitivity, a hypersensitivity in the gut, we really don't know, but it does seem pretty clear that there's something else going on beyond just the dysmotility. And so that accounts for some of the other things that you may have experienced, that I've certainly experienced, that I've heard from a lot of my clients and a lot of people who contact me via email. A lot of times the severity of the symptoms doesn't match up with the delay in gastric emptying. So you can have a mild delay but really severe symptoms. Or, I've also heard recently from a number of people who have said, I had a repeat emptying scan. It's been a year, it's been 2 years, whatever, since I was diagnosed, and they did a repeat emptying scan, and it's better. The emptying has improved. It's near normal even, but I don't feel better, and the doctors think that I should, kind of what's going on. And I think that really has to do with the fact that it's not just motility that most of us are dealing with, in terms of what's causing the symptoms. So, on the flip side, we have something like the gastric neurostimulator, where that doesn't, for the vast majority of people, that doesn't facilitate emptying, it doesn't increase emptying, but it does, affect and improve the symptoms of nausea and vomiting. So on one hand, we've got the Prokinetics here that help the stomach to empty, and then on the other hand, we got the neurostimulator that doesn't help it to empty, but does help the symptoms. So we don't really have anything that kind of tackles both sides. We don't really have, that magic bullet. Hopefully we will in the future, but right now we don't. And right now, the key is really an integrated management plan. I mean, that's how I can say that I'm living well with gastroparesis. It's not just because I manage my diet. It's not just because I take, Zofran, which is an antiemetic. Antiemetics decrease nausea and vomiting. It's not just because I have a gastric neurostimulator, or just because I do yoga, or just because I am, getting complementary therapies like craniosacral therapy. It's all of those things together. And so, I think that's really what we have to do right now, because we don't have that magic bullet. We don't have, that treatment that really takes care of everything. So that's actually what we're going to be doing in the 12-week program. We're going to be building that kind of comprehensive, integrated management plan. Step by step, we're going to start with, going through all the medical treatments, the complementary therapies. We'll do diet, nutrition, lifestyle, stress management, everything, social circles, support, your attitude. It's all a part of the management plan. And so we're going to go step by step, and we're going to build comprehensive management plans so that, the participants in the program, when they're done, they too can say, I'm living well with gastroparesis. So if you're interested in that, just a quick aside, it starts in less than 2 weeks, and there are literally like 2 spots left. So if you're interested, jump on it. Otherwise, I will hopefully see you on the Facebook page. It's facebook.com/livingwithgastroparesis. If you like this video, like it, share it, please, and I will see you next week for another FAQ Friday. Thanks for joining me. Bye.